You're ready to begin.
Good morning, Denisha. If you'll conduct the roll call of board members, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Tommy Hopkins,
Here.
Kathleen Ruth,
Here.
Norm Boyd,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Shane Mobley,
Here.
Cynthia Rucker,
Here.
Robert Coles. Robert Coles. Chairman, that completes my roll call.
Thank you, Denisha. Good morning to everyone. It sounds like we have almost a full contingency this morning, and we'll call the meeting to order. Presented to you earlier with the minutes from October the 9th. I'll ask Kathleen Ruth if she's had an opportunity to review those, and would she move to approve?
Yes, Mr. Chairman, I have reviewed the minutes for October 9th and move to approve.
I have a motion for approval of those minutes. Do we hear a second?
Second. Tommy.
Tommy Hopkins has seconded the motion. Any further discussion, corrections, additions? Hearing none, all those in favor of the motion signify by aye.
Aye.
All opposed, no. Minutes are approved. Thank you. Very brief opening comments this morning. I once again want to thank the department and all my fellow board members for coming down on last month to Dublin. It was a great time hosting you here, and appreciate your effort to be here. We missed several of you, and hope if we do something like that again, we can all be together. I've had a great deal of positive feedback regarding our meeting. I got a nice letter from Hospital Corporation of America and Fairview Park Hospital, the city of Dublin, and the county, and there was several articles in the newspaper after you guys left town regarding the meeting. So thank you for making that effort to be here, and I think it was a good opportunity to showcase the department out in the remainder of Georgia. So I thank you again. In front of us today on our agenda, we only have one item for consideration for final adoption. Then we'll have a presentation and informational update. So it'll be a rather brief agenda this morning. So with that, I would ask Commissioner Burke if he's got a report for us and then something to present to us. Commissioner, good morning.
Good morning, Mr. Chairman. Good morning, board members. And as always, we appreciate the dedication that y'all provide to us to help support our agency in the mission that we strive to do every day, which is to improve the health of our fellow Georgians. One of the things that we've talked about the last several months is trying to update y'all on the Rural Health Transformation Grant that was part of HR 1. That grant was submitted, I think, a day early. We're proud of our team for getting it finished and making sure that we had it submitted well ahead of the deadline, because all of us know sometimes technology fails and we don't want to wait till the last minute. So we submitted our proposals, and we did get a word from CMS that our proposal was received in good order. We have also posted our proposal on our website for full transparency, and also added some other documents to support it for frequently asked questions and so forth, so people can better understand what we're working for. As far as the feedback from CMS, we have been advised that we will hear from them sometime before the end of the year with a initial answer on our application, and then there'll be a period of communication between us and CMS, and we will get our final award before the end of the calendar year. So the budget and so forth are yet to come. We certainly, once we get that finalized, we'll make sure that we share that as well. It's a long-term process. It's a 5-year grant, and it'll take a lot of work to implement. And so we ask for y'all's grace and support as we develop all of the infrastructure around that rural healthcare transformation grant. Mr. Chairman, you have a question?
This is Tommy. I have a question. I've reviewed some of the stuff that's available, and my question is, how do we define the metrics on how the money will be dispersed if we get it, and what kind of input will the board have on seeing where the monies go?
Once we get the budget, so to speak, from CMS, what our actual award is, then in my mind, that's when the real work will start, as far as making sure that we have a strong implementation plan. We are doing this work obviously at the direction of the governor and his staff, and so they'll have a lot of input as well. So we'll be fully transparent with the board as we move through this process. We just can't get ahead of ourselves and start talking about budget until we know what our award is from CMS.
Thank you.
The other thing I wanted to update you on, because we do get questions about the status of our DPP submission. The government shutdown, which sounds like may be ending, did affect some of the communication with CMS, but all of their questions for us in relation to the DPPs have been answered, and so we are waiting on their determination on that process as well. DPPs, just like this grant, involve communication and an agreement among both parties, the state and CMS, on those final awards, and so we'll certainly be letting you guys know when we hear back from them on that. And finally, Mr. Chairman, I want to let our folks know that have milestones how much we appreciate their support of our agency. We've got a pretty long list, so please bear with me, which is a great thing. Diane Patterson, State Health Benefit Plan at 30 years. Georgina Bowen at Healthcare Facility Regulation, 25 years. Leslie Austin at Medical Assistant Plans Division, 20 years. Cassandra Denise Richardson, Healthcare Facility Regulation, 10 years. LaShonda Smith, Division of Financial Management, 10 years. Kendra Lee, Office of Inspector General, 10 years. Carla Forbes, Office of Inspector General, 10 years. Elizabeth Thomas, Healthcare Facility Regulation, 5 years. Michael Groover, Georgia Board of Healthcare Workforce, 5 years. Judy Gardner, Georgia Composite Medical Board, 5 years. Precious Gibbons, Healthcare Facility Regulation Division, 5 years. Kenya Pledger, Healthcare Facility Regulation, 5 years. Charles Page, Georgia Boards of Dentistry, 5 years. Cecil Cordell, Georgia Boards of Dentistry, 5 years. Amy Reeves, Georgia Board of Healthcare Workforce, 5 years. Marie Elizabeth Stone, Georgia Composite Medical Board, 1 year. Ashley Marie Peck, Office of Analytics and Program Improvement, 1 year. And Diana Reese, Healthcare Facility Regulation Division, 1 year. That concludes our milestones and my remarks, Mr. Chairman. Be glad to answer any questions. And
Thank you,
otherwise,
Commissioner.
I'll turn it
Anyone
over to you.
have questions for Dr. Burke? Well, hearing none, thank you for that report. We certainly echo congratulations to all those milestones that you mentioned. Those are very important. The first item on our agenda, our working agenda, is medical assistance plans rate increase for Babies Can't Wait service coordinators. And Emily Hatchett, we will ask you to present that to us, please.
Yes, sir. Good morning, and thank you, Chairman Folsom, Commissioner Burke, and members of the board. My name is Emily Hatchett, and I serve as Senior Policy Advisor to the Medicaid Director within the Medical Assistance Plans Division at the Department of Community Health. This morning, I am presenting for final adoption the department's proposed rate increase for Babies Can't Wait service coordinators. Babies Can't Wait service coordinators provide services to Medicaid and Peach Care for Kids members. Depending on the member's coverage, these services may be reimbursed by the Department of Public Health or the Department of Community Health. Pursuant to House Bill 68, passed in the 2025 legislative session, DPH increased rates for service coordinators. DCH proposes to increase the fee-for-service reimbursement rates for the following Babies Can't Wait codes effective October 10th, 2025. T2022, which is case management per month for the first 6 months. The current rate is $145, and the new rate will be $152.25. T2022 with the TS modifier, which is case management per month after 6 months. The current rate is $135, and the new rate will be $141.75. Finally, code 96110, which is a developmental screening and testing code. The current rate is $11.77, and the new rate will be $12.36. The cost impact for state fiscal year 2026 is $507,558 state dollars, $998,996 federal dollars, for a combined total of $1,506,554. The cost impact for state fiscal year 2027 is $698,917 state dollars, $1,391,928 federal dollars, for a total of $2,090,845. As part of the final adoption process, the department conducted a public notice and comment period. A public hearing was held on October 15th, 2025 at 11 a.m. via Zoom audio, and written comments were accepted through October 22nd, 2025. No oral or written comments were received. So given the absence of any concerns or objections during the public comment period, the department respectfully requests the board's final adoption of the rate increase for Babies Can't Wait service coordinators, effective retroactive to October 10th, 2025. Thank you for your attention, and I'm happy to answer any questions.
Thank you, Emily. Any questions for Emily? If not, is there a motion for final adoption?
Motion for final adoption, Cynthia Rucker.
Dr. Rucker has made a motion for final adoption. Do we hear a second?
Shane Mobley.
Shane Mobley has seconded the motion. Any further discussion? Hear none, all those in favor of the motion signify by aye.
Aye.
Opposed, no. Anyone abstaining? Motion carries. Thank you, Emily, for your presentation.
Thank you all.
Next on our agenda is an informational update, alignment with the Centers for Medicare and Medicaid Services, federal requirements under the Consolidated Appropriations Act of 2022. Marisol Owens, our third-party liability director, will present to us. Good morning.
Good morning. Good morning, Chairman Folsom, members of the board, and Commissioner Dr. Burke, and all present. I'm Marisol Owens, third-party liability director in the Office of Inspector General. Today, I'm providing an update for the alignment with the Centers for Medicare and Medicaid, CMS, for federal requirements under the Consolidated Appropriations Act of 2022 for a state plan amendment approval update. Pursuant to Senate Bill 276 passed in the 2025 legislative session, the Department of Community Health amended the state plan 4.22-B under the section for third-party liability payment of claims to reflect federal requirements, ensuring compliance with the Consolidated Appropriations Act of 2022, to include the following language. Recovery of medical assistance. All entities must accept the state's payment for a healthcare item or service on behalf of a recipient of medical assistance as the third-party payer's authorization of provision of those services, and shall not refuse to pay for a healthcare item or service solely on the basis of the third-party payer previously did not authorize such item or service. All entities must respond to the state inquiry regarding a status of a claim for payment for any healthcare item or service within a 60-day of receiving an inquiry. DCH received approval from the Centers for Medicare and Medicaid Services, CMS, on September 9, 2025 for State Plan Amendment 25-0009, which reflects the federal and state requirements effective July 1st, 2025. This notification is presented to the board for awareness only. No action is required. Thank you. Do you have any questions for me?
Any questions from board members? Hearing none, thank you for that presentation.
Thank you.
Is there any new business that needs to come before the board this morning? Well, a very brief agenda. I would like to wish each of you a happy Thanksgiving coming right up, and hoping that you get to spend some quality time with family and friends. And regardless of any circumstances, we all have something to be thankful for. So I hope you all have a wonderful Thanksgiving. If there's no other business, our next meeting will be December the 11th, and we will see you then, if not before. And thank you for your time and attention this morning. We stand adjourned.
Thank you.
Thank you, Mr. Chairman.
Thank you.